Well, historically I've had problems with my knees. I played a lot of Gaelic football when I was younger. Obviously I did a little bit of dancing in my time, and unfortunately I was playing some charity football games in recent times. And when I say recent times, over the last 10-15 years, and I damaged my ACL. I had both ACLs and both knees fixed. That's my acute cruciate ligament. And that was between 10 and 15 years ago. But more recent times, I've struggled really badly with knee problems. Having had MRI scans done, it became apparent that my meniscus and my cartilage was non-existent in both knees, and I was progressively getting much worse. Having attended some surgeons in the country, their advice to me was to go under the knife and to have full knee replacements on both knees. This was something I was considering. Last October, being now nearly 7 or 8 months away, I climbed Mount Kenya, and I shouldn't have. Frankly, I shouldn't have. When I came home, the knees were at an all-time bad, and I visited some surgeons with MRI scans, and their advice at the time was to go under the knife and to have 2 new knees done. I was reluctant to do that because it could possibly take me out of work for 3 months, probably longer. If there was any sign of infection, God knows how long I might have been out of work. And that just wasn't an option for me. And it was a very difficult time because I didn't know what to do. Medica came on board through a friend of mine, and I came and had a chat here with the doctor. He had a look at the MRI scans, he had a look at my knees, and he was confident with PRP injections, platelet-rich plasma injections, which are injections, the plasma taken out of my blood and then re-injected into my knees, and also stem cell treatment, which was taking the bone marrow from my hip and spinning it and re-injecting it into my knees as stem cells. I went through this procedure. Instead of having new knees done, I went through this procedure, and I can't tell you the difference. Honest to God, it's a new lease of life. No knife, no open knee, just a couple of injections, and it's taken now 2, 3, coming into 4 months, and it's getting better and better all the time. I'm not without pain. But to give you an idea, I used to take 2 painkillers before I'd start a round of golf. I'd have to take 2 more by the 9th hole, and I'd have to take 2 more at the 15th or 16th hole to finish the round of golf. I'm not taking any painkillers now to walk a full round of golf, 5 hours. The treatment has been miraculous for me, and I'm here to tell my story because there's so many surgeons out there that just love to get patients, young men and women, into their surgery and open them up and give a full knee transplant. And there's no need for it.
Yeah.
There's your own body can heal itself. I mean, the day will come that I probably will need to get new knees, but it's not right now. I'm busy. I like sport. I like playing paddle tennis. I like playing golf. And I'm back doing what I'm doing without being in pain, without eating the painkillers, and it is quite miraculous. And I would solidarily recommend it to anyone. Everything I've experienced here in Medica has been a great experience. From the nurses that are taking the blood, and from my doctor, the consultant that has looked after me on a level that is just like a personal friend. I enjoy coming here to the clinic and there's a bit of banter, it's light-hearted, but the work is being done, and my health is improving, my knee health is improving, so I'm a very happy patient. I certainly will recommend it to others. I do recommend it to others, and I will recommend it to others, yes.